Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to our Parent Support Group event in collaboration with the NICC Muslim Mental Health Aid. My name is Suhaila Taha, and I am a second year at OSU and the co-director of NICC Muslim Mental Health Aid. The webinar is live streamed and will be available as a recording on our North Ohio YouTube channel. Proper education is crucial for development in children and young adolescents, and we're constantly trying to find ways to advance our youth's knowledge and offer them healthy and safe opportunities. Behavioral health is crucial for children's education. It is not uncommon to confuse behavioral health with mental health, and both are often minimized within our community. Disruptive behaviors and learning disabilities affect many children and can have long-term effects on a child if left unnoticed and untreated. Today, we are looking forward to learning about the impact of behavioral health on our youth in ways that parents, teachers, and mentors can help our youth to live well and become the best versions of themselves. We are honored to host our compassionate expert tonight, Dr. Uram Ahmed. Dr. Ahmed is a child and adolescent psychiatrist based in Cleveland, Ohio. She obtained her undergraduate degree at Northeast Ohio Medical University and her medical degree from Case Western Reserve University / University Hospitals Cleveland Medical Center. Dr. Ahmed has joined us to address this topic and answer any of your questions. We will do our best to dedicate the last 20 minutes to answer your questions and comments, so please share those in the Q&A box. Remember that you do have the option for asking anonymously, and in either case, please avoid the use of any personalized cases or any private patient information. For those watching through YouTube or Facebook, please be aware that we will only be seeing the questions that are sent through the Zoom Q&A. And whenever you are ready, Dr. Ahmed, the floor is yours.
Thank you so much. Assalamu alaikum, everyone. And thank you so much for having me. As the introduction stated, my name is Aram, and I'm a practicing child and adolescent psychiatrist in Cleveland, Ohio. I'm honored here today to talk to you a little bit about impact of mental health and behavioral health in our youth. We will be spending some time talking about some of the common signs of behavioral health and mental health concerns in children and adolescents, as well as identifying some tools for teachers and school staff to use to identify and address concerns in the school setting, and to recognize the influence of learning disorders on behavior and symptoms in the classroom. I wanted to add that I presently have no relevant disclosures pertaining to this presentation. I wanted to spend a little bit of time emphasizing why this is important. So according to studies within the last 4 to 5 years, there have been significant increases in children and adolescents diagnosed with anxiety, depression, and behavioral and conduct problems. Between 2016 and 2020, there was also notable decreases in physical activity, as well as increased caregiver burden and distress, which may also impact the mental and behavioral health of the students that we're seeing in the classroom. I also think it's important to recognize that our students spend such a significant part of their lives in the classroom during their middle school and high school years. And so it's really important that we be attuned to the signs that they might be struggling so that we can help intervene in a timely manner. As teachers and school staff, you are optimal in terms of identifying these symptoms. Many times these symptoms might not necessarily be evident in other settings, or they might go missed or undiagnosed. And so I really want to encourage teachers and school staff to be able to recognize and help identify concerning behaviors. So when we're talking about children, we talk about multiple different factors that pertain to their development. It's important to recognize that children are a product of their environment and a product of their upbringing, as well as a product of their temperament, their coping styles, and any biological or genetic influences. So we like to break it down in terms of 3 different domains: the biological domain, which might include things like genetic vulnerability, things like medical illness or neurological illness that might impact the development of the brain, things like neurochemistry and physical health as well. In terms of psychological factors, we talk a lot about behaviors and personality types, as well as attitudes and beliefs towards illness, or attitudes and beliefs towards religion or spirituality. We also identify coping and social skills as part of the psychological factors that might influence well-being or illness. And things such as self-esteem, emotion, and self-reliance and self-resilience. And then we talk about social factors. So this could be things in their environment. This could be family relationships. It could be the level of chaos or stability within the home that they're living in. It could also be peer relationships, influence of school and education, family background. And as you can see in this diagram here, there could be a lot of overlap between several of these domains. So one characteristic or quality may fit into both the biological and the psychological domain. Some commonly recognized concerns in the classroom that you may have already come across or you may continue to come across in the future are things such as anxiety, school avoidance, depression, attention deficit hyperactivity disorder, oppositional defiant disorder, post-traumatic stress disorder, and learning disorders and intellectual disabilities. Children with anxiety can present in different ways. You might have a child that might be very reactive in their anxiety, or you might have a child that could be very withdrawn and avoidant in their anxiety. In younger kids, we might notice separation anxiety, where the younger children might seem more clingy than normal. They might have problems with separating from their primary caregiver. They might also talk about vague physical symptoms, things like headaches or stomach aches. Kids with anxiety also demonstrate changes in their behavior and their sleep. These kids are oftentimes worrying about a whole host of things, not just one thing. They could be worried about the future. They could be worried about bad things happening at home. They could be worried about the health of their loved ones. These individuals or children and adolescents might present as very restless or fidgety in the classroom. And they can also have bouts of irritability. And so they might get angry very easily. They might get annoyed very easily or frustrated very easily. Oftentimes, kids with anxiety may also have trouble in terms of relating to other people and communicating their needs. Those who might be avoidant of school will oftentimes make up excuses to try to get out of going to school. They might also it might be very challenging to engage them in their school work. These are the kids that come to school and then talk about having a stomach ache or needing to go to the nurse's office or needing to go home. I'm sure as a result of the pandemic, you might have seen these levels increase in your students. We found that initially when the pandemic started, kids were doing pretty well, and the kids who were anxious about school were no longer anxious. But the longer the break went from school and the longer they were in the virtual classrooms, it became harder to have them return to the traditional school setting. And now we're seeing an increase in school-based anxiety. In terms of depression, we oftentimes see a lot of the similar symptoms in kids who are depressed. It's important to recognize that anxiety and depression can affect children and adolescents at all levels. I have seen children who are anxious starting at the age of 5. I have also seen adolescents who are anxious up to 17. Similarly, I've seen kids who identify feeling sad or depressed at a younger age, whereas I've often also seen the adolescent who is nearing adulthood endorse symptoms of depression. When children and adolescents are depressed or anxious, they oftentimes present with physical symptoms. So things like changes in their appetite or sleep, things like headaches or stomach aches. Also, kids might experience persistent irritability. And I think this is where it's really important, to keep an eye out and keep track of when a kid's irritability is persisting and becoming more chronic, because that might signal something really important that we're missing. Sometimes these children and adolescents might be very tired, especially if they're not sleeping at night. They might have trouble staying awake during the day. You might find them falling asleep in the classroom or falling asleep during recess. These children might also struggle with lower self-esteem, and more seriously, they might start to think about ways to hurt themselves or might start to engage in self-harming behaviors. Attention deficit hyperactivity disorder is a disorder that we commonly see in children. It typically starts around school age, and the symptoms must be present in more than one setting. There's different types of attention deficit hyperactivity disorder. There are individuals who struggle primarily with problems with concentration or inattentiveness. Then there are individuals that struggle with hyperactive behavior. And then there are individuals that struggle with a combination. So oftentimes in the school setting, you might find that a student is very forgetful. They might have trouble sitting still in their seat. They're the student that you're always trying to get their attention back onto what you're talking about. They might have trouble engaging in conversation in the sense that they're always interrupting you or other people. They have difficulty sitting still. These kids might get into fights very easily with other individuals simply because they are more impulsive. It's also important to recognize that sometimes kids can present differently at different ages. Girls might present initially with more inattentiveness or daydreaming-like behavior, which oftentimes gets missed or diagnosed as anxiety or something else. And symptoms may become more prominent when the school setting changes or when their style of learning changes. So we oftentimes see that the point of transition from elementary school to middle school or middle school to high school tends to be the hardest times for kids. And this is when symptoms of ADHD might become stronger or more prominent. It's also important to recognize that in order for a diagnosis of attention deficit hyperactivity disorder to be made, the symptoms must be present before the age of 12. Many of our children, unfortunately, struggle with trauma. In this day and age, it's important that we think about things from a trauma-informed perspective. Trauma could be various things. It might not be what we typically think of trauma as being in terms of physical abuse. Trauma could look like neglect. It could look like not having your basic needs taken care of. It could even be witnessing domestic violence in the home or in the community. It could be having a parent that is incarcerated for a crime. It could be being a victim of sexual abuse. It could be being a victim of verbal abuse. It could be being a victim of or being a child of someone that uses substances. So I think it's very important that we recognize that trauma exists everywhere, and identifying any potential sources of trauma or neglect in children, I think, can go a long way to understanding why they are the way they are and how to help them when they struggle with these behaviors. Classically, kids who've been traumatized might experience problems with nightmares or flashbacks of the trauma. They might be very fearful of strange situations. They might have trouble relating to other individuals, including adults in their lives. They might have trouble concentrating in school. They oftentimes will isolate themselves. And in more severe circumstances, they might engage in risk-taking or precocious behaviors. It's important to remember that irritability and sleep disturbance are common hallmark features in children and adolescents who have experienced trauma. And I want to also add that, when we think about things from a cultural or religious perspective, I think it's important to acknowledge and recognize that while we want to believe and recognize that our community might not be struggling with these issues such as trauma or substance abuse or abuse or neglect, it is everywhere, unfortunately. And there's a variety of different factors that are responsible for it, which I won't go into further. But understanding and approaching everyone from a trauma-informed perspective and a curious perspective into their life experiences, I think can go a long way into helping a child feel more comfortable in their school environment. I have seen, and we know based on the literature, that childhood trauma or neglect can have significant impact on their development and their trajectory into adulthood. Not only can childhood trauma impact one's physical health, it can also impact the relationships. Children with trauma may have difficulty attaching to their caregivers, or they might have difficulty trusting adults in their lives. Or on the opposite end, they might be too trusting and might put themselves in unsafe situations because of that excessive trust. We know that exposure to trauma and neglect can have significant impact on the development of the brain. Individuals with trauma have a smaller brain size. There's definitely an impact on the connections that are forming in the brain and the synapses and the neurons. There's also chemical changes that occur in the brain that might impact one's ability to respond to stress. It might impact one's ability to respond to frustration. Those with childhood trauma might also demonstrate delays in language and speech, and they might need to require things like speech therapy or occupational therapy in order to catch up. They might have difficulty forming sentences. They might also have difficulty expressing their emotions. Individuals with trauma might also engage in risky behaviors. So I've had many children, unfortunately, who are victims of trauma, who unfortunately go on to run away from home or engage in risky sexual behaviors or substance use. And this, I think, spans across all cultures and all religious beliefs from my clinical experience. Individuals with trauma might also struggle with regulating their emotions and verbalizing what it is that they're experiencing. So in the classroom, if a kid has a history of trauma and is under a stressful situation, for which school is a stressful situation, can be very stressful for most individuals, most children, that experience of trauma might make it difficult for them to express what they're feeling in a safe and healthy manner. It's also, I think, helpful and important to recognize that trauma symptoms can overlap with many different other symptoms, and sometimes it's hard to tease apart. So for example, if you have an individual with trauma, who has a history of trauma, it might be really hard to distinguish some of their behaviors from that of attention deficit hyperactivity disorder. So you can see here in this diagram that there's an overlap in symptoms. These kids might have difficulty concentrating and learning in school. They might often seem like they're not listening because they're zoned out or they're in a different place mentally. They might be very disorganized. They oftentimes, both individuals who have experienced trauma and those who are who have ADHD also will have difficulty sleeping, and they can be very restless. So it can be even harder then when a child has a history of trauma or neglect, but also has ADHD, because it requires extra special attention to treatment and intervention. Individuals with trauma, if you're approaching them in the classroom, if something about your behavior or something related to your verbal or nonverbal behaviors reminds them of that trauma, they might startle very easily, and they might then try to avoid that situation further. They might become very quick to anger, or might become very irritable with adults that remind them of the traumatic situation that they've been in or that they continue to be in. These individuals, oftentimes when a kid has been traumatized, when a kid has been neglected, they have a hard time trusting in the environment around them, and they oftentimes always feel like they're on alert, and it can be really hard for them to trust an adult and open up to someone. So some signs that might be observed in the classroom that would signal need for additional intervention or investigation. As I mentioned, a child that is presenting with new onset or persistent irritability in the classroom, and this irritability could look like, frequent emotional outbursts. It could look like frequent annoyance. It could even, look like frequent crying spells in the classroom. Kids might also have trouble with sleep, indicating that, by evidence that they're falling asleep in the classroom, or they voice to you that they're not getting enough sleep at home, or they physically appear exhausted. A child that has suddenly become more isolative or withdrawn is concerning, and that should be a red flag that something is going on. It's important to know that it might not be something that's happening in the classroom. It could be something that's happening at home or outside of the home. If symptoms are present in one setting but not the other, it's important that we ask ourselves, what is it that's going on in that setting that the behaviors are happening in, or what is it that's not going on in that setting that might be contributing to these behaviors? If you observe new risk-taking behaviors or new defiance or new oppositional behaviors, that would also be really important to screen further for what's going on. And then, of course, if you observe or see or are concerned about any signs of abuse or neglect, that would be, sign for additional investigation or intervention. Some interventions that can be helpful in the classroom setting. It's always helpful for a child to know that there's an adult in their life that cares for them and that truly wants to understand how they're doing. Approaching children from a very non-judgmental space and offering time and physical space for support is really important. This could look like regular check-ins with the student and the family on their progress and how they're doing emotionally. Keeping an eye out, in your mind and, within the school as to who might be struggling even more, and making an effort to pay closer attention to them, pay closer attention to when they're coming to school versus not coming to school, and then reaching out to parents. Kids and adolescents thrive on structure. Structure is so important for them, and they need to know what the limits are and what the boundaries are of the allowed behavior. And so this is an opportunity to make sure that the rules are clearly stated and identified so that kids understand to what standards they're being held to. School avoidance is something that we face a lot in mental health profession as well as in school. And it can be really tempting to, send the child home or to allow them to skip school as a parent, but that only unfortunately serves to reinforce the avoidance. And so what we recommend doing is not sending the kid home from school, or, significantly limiting under what circumstances sending the kid home from school would be allowed in. So these kids oftentimes come up with excuses about being sick. Their stomach is hurting, their head is hurting. And so offering, help with that, giving some time for monitoring, whether it's in a nurse's office or a teacher's office, and then being very clear about returning back to the school environment. It can be very tempting to, have them call their parents to come and pick them up. But unfortunately, what that does is that makes the avoidance worse, and it gets harder to reintegrate within the school setting. It's also really important when there's a case of school avoidance or school-based anxiety that the parents and the teachers be on the same page in terms of intervention and approach in terms of management, and that be consistent. Kids thrive on consistency too. So if we're enforcing a treatment plan or a certain rule or structure, being very consistent with how it's being implemented is really important. I also sometimes feel that it's helpful and beneficial to involve the student in that discussion, depending on their age and their cognitive abilities and their emotional maturity. It would be helpful to involve the child in how to help them. And so this might look like a discussion with the child and the parents, similar, for example, hey, I noticed that you're having problems in the school. Our goal is to keep you in school and to keep you in the classroom every day for as long as possible. I understand that's a challenge right now, but how can we help you to get there? And it may be that the school and the parents and the child have to decide on a gradual return to school plan, depending on the severity of symptoms. Talking a little bit about learning disorders, there's various types of learning disorders, and kids can have problems with processing the information. They might have problems with speech, including challenges with pronouncing the words, comprehending what it is that they're reading, and recalling and remembering what it is that they're being read or taught. Kids might also have problems with planning and organization. They might have challenges with fine motor skills, and this can oftentimes lead to avoidance of doing the schoolwork. And it can also lead to oppositional behaviors and defiance in school. And so it can be really challenging sometimes to try to differentiate between a child who is defiant because they're anxious or because they don't want to do the work, and a child that simply is unable to do the work because they have a learning disorder or a learning disability. In terms of working with children with learning disorders or suspected learning disorders, it's important that any concerns for the child be communicated with their parent or caregiver, and that the parent or caregiver be given specific description of the behaviors and observations in the classroom that have been made. It's also really important that they undergo testing for any vision, hearing impairment, or developmental issues. And this is where it becomes important to make sure that the kids in our schools are being seen by a pediatrician or a primary care doctor on a regular basis. Oftentimes, nearly most of the time, these individuals, if we're suspecting a learning disorder or learning disability, it requires comprehensive formal neuropsychological testing to assess their IQ and academic achievement, as well as other abilities. If a child has been diagnosed with a learning disorder or learning disability, they may need to be provided accommodations and extra help in the classroom or at home. They might need to be provided with extra time in completing the work. They might need to be provided more one-on-one attention in terms of helping with doing the homework and understanding the information. Occupational and speech therapy may be required for individuals who have a speech disability or a learning disorder or problems with their fine motor skills. So that brings me towards the end of my talk. In conclusion, I wanted to just emphasize that to me and to many others, the school environment is such an important place, and a place of growth, a place of development, and a place of formation of one's identity. And unfortunately, it oftentimes also is the place where mental health and behavioral health concerns are first identified. And this, I think, places everyone in the community at a significant advantage, because if we can have our school colleagues be able to identify and potentially offer intervention or offer places to go to get the appropriate intervention, we can thereby minimize or prevent any further complications from happening further. Early identification and intervention is key. If we are able to early identify and intervene, we can have significant impact on a child's social, emotional, cognitive, and academic development. And it's really important within our schools that we be able to provide the support and guidance for children and adolescents as well as their families. Thank you. I'm going to stop sharing if that's okay.
Yeah, thank you so much, Dr. Ahmed, for that informative presentation. So far, we have no questions in the chat or on Facebook. So I just want to thank you again and thank everybody for tuning in and listening. If you would like to receive notifications for future events or would like to suggest events, please send an email to psg@norohio.org to sign up for the Google group. And for any questions or feedback for the health literacy program, please email hlp@norohio.org. And you may also reach out to the education@norohio.org. We wish everybody a blessed and peaced Ramadan. And thank you, everybody, again. Stay healthy and safe.
Thank you.